Okay, so here we've got a signathid. We've got the, I guess we're following the mouth through to the pharynx, and then through the, we'll probably have to move a bit quicker. Yep, pharynx, and then keep going, and then that's the sort of distal esophagus, and you can see there's a little bit of liver south of the arrow there. Yep, and we can see if we have a look at the distal esophagus, you can see there's some reaction happening there with the more blue that's happening there. But first thing, we'll probably go to the gills, because I tend to like to look at fish gills as the first place to examine. You notice that it's actually away outside of the head. That's because I'm trying to save the client some money by squishing as much tissues into the one cassette as I can. So if we move right, zoom in to the gills, we'd like to show you what a normal gill would look like. So if we move south and about there, and west, the one in the corner, yep, and we'll zoom in on that. That looks like what a normal gill should look like. So it should have this sort of central cartilage, that's the backbone, and it's sort of a tree shape, and it's got these secondary lamellae that sort of extend out, and there should be sort of single epithelium thick, and then it's got blood inside. So the blood should be in intimate contact with the water without it being too thickened. But you notice here that this gill is not exactly perfect. You can see there's a little bug there that looks like a ciliated protozoa, possibly urinema, because that's the most common thing that happens in these guys. But at the moment, seeing this critter, I'm not too worried, because it's not a urinema. I guess people always fight or debate whether it's a primary or secondary pathogen, but in this case I think it's just browsing. It's not invading the tissues or anything. It's got no factors causing it to become a pathogen. Urinema tends to like to eat bacteria, so you'll see, I guess if we move to a different gill filament, the reason why the urinema might be there. So if we keep going north and here, and we zoom in on this gill filament, you'll see there's a lot of blue. That blue, if we can zoom in a bit closer, is actually a whole heap of different bacteria. It tends to be sort of filamentous bacteria here, and it's causing marked damage. You can see this fibrinoid necrosis of the secondary lamellae, congestion of the, I guess, the branchial vessels, necrosis of the lamellae as well. So that's ultimately what's caused the demise of this seahorse. So that's quite severe. But what's actually caused the snick to get weak and for it to die? So we'll actually go and have a look at the distal part of the esophagus, as we had seen previously. So as we move across past its brain, here is what we can see. If we keep going to the left, all the way to the distal esophagus, and you keep going there. Yep, and we'll zoom in on the esophagus. So if we go towards the left, I'd like to show you what normal esophagus looks like. So we'll zoom in on that. And here you can see the epithelium is fairly thin. It's maybe 1 to 2 cells thick, and it's attached to the connective tissue beneath. But if we move more to the right, you'll see that the epithelium is detached from the underlying connective tissue. And also, if you look at the connective tissue, there's a lot more of these blue type cells inside. That means it's being infiltrated by inflammatory cells. And if we keep moving to the right, and we'll zoom in on these, you see that we've lost the epithelial covering. There's necrosis, sloughing of cells, and there's a lot of bacteria associated with this. And I guess working with dead animals, we tend to want to work out, is this a real change or it's not a real change? So if we look at the next slide, and then follow the sort of gut epithelium down, you'll see that there's a lot of this change happening throughout the gut, and most obvious would be the sort of the distal part of the gut. So that's the swim bladder we just looked at, and here's the distal part of the intestine. So if we zoom right in on that, here you can see, I guess, on one aspect, I guess on the top of your screen here, you can see that there's epithelium intact, but it's got a lot of edema. But on the bottom of your screen here, we've got a lot of necrosis and death and a lot of blue. And that blue, if we actually zoom in really close, they are because we can actually see bacteria there. But what's causing this? Is this bacteria a primary pathogen, or is it secondary from the fish just being ill? I guess in this case we cannot say definitively. To me, I guess it does look like it could be a primary pathogen. But if we go back and have a look at that piece of liver, you might see that when we have a look at the liver at the other slide, near the distal esophagus, you can see that the hepatocytes are actually very, very small. So if we zoom in on that, so triangular piece there. So it's really good to have a look at the liver cells. Normal healthy liver cells should be quite large and contain vacuoles, I guess, or bubbles of fat or glycogen, but in this case they are pretty much shrunken and really small, so it's a bit of hepatocellular atrophy. And we zoom in closer, we can see that this liver should actually be bluish color, but you can see here it's actually brownish. So this brown pigment is most likely going to be lipofuscin, which is, I guess, breakdown pigment, and you tend to see it as a normal thing occurring in older animals, but in an animal or with chronic inflammation. But I think in this case it's probably because it's chronically malnourished. That's why there's no vacuolation, and also there's a lot of this pigment buildup. And I suspect that maybe the fish hasn't had proper nutrition for a while. That's depressed its immune system, leading to enteritis, bacterial enteritis, bacterial branchitis in the gills as well. And so so that's why this fish isn't doing too well. If you go to my blog, thefishvet.com, and search under seahorse, I've got a few articles there or posts where I've talked about what seahorses should be fed. But basically they pretty much grazes, or they sort of predate on little crustaceans throughout the day. They tend to have a full stomach by the end of the day, and then they stop feeding overnight, and then in the morning when the sun rises they'll start feeding again. So how much should you actually feed these guys? There's a rule of thumb. The size of the fish's stomach, or loosely, is about the size of the eye. So you probably want to feed them, if you're talking about blocks of mysid shrimp, frozen ones, maybe per seahorse, you may want to do about 2 to 3 blocks per seahorse, but you have to always make sure that you don't pollute the tank. So I guess people who are working from 9 to 5, the suggested thing would be to feed them the mysid shrimp. Once they've completed eating that, then you put in your live brine shrimp so they can graze through the day. And then first thing in the evening when you get back, give them another feed, and I guess before you go to bed and the lights are out, you can give them another feed then. So that will give them at least 4 feeds a day, and hopefully that should ensure your seahorses live a long, healthy life.